In less than a week, the government could shut down. And millions of seniors are asking, what happens to Social Security checks and Medicare if that deadline passes? The answer depends on what gets written into the budget bill. And right now, both parties are fighting over what to add, what to cut, and how those choices could ripple into programs like Social Security, Medicare, and Medicaid. The surprising part is how much of that debate ties back to seniors. What's happening? This shutdown is about the fight over what gets included in the budget. Congress has until October 1st to either pass a new budget or agree on a short-term extension. If they don't, the government shuts down. That means federal workers get furloughed, military families could go without paychecks, and services across the country slow to a crawl. And in the middle of all that, seniors are left wondering if Social Security and Medicare will be caught up in the mess. Why it's happening? The deadlock comes down to what each party wants in the budget. Democrats want to extend Affordable Care Act subsidies, reverse Medicaid cuts, restore frozen funds like public broadcasting, and add oversight rules on how the White House spends money. Republicans, meanwhile, are demanding a clean bill. Just keep the government open until November without adding policy changes. One side says fix healthcare and restore funding now. The other side says not in a short-term bill. And that clash is what's pushing the government towards shutdown. What this means for Social Security. So what does this mean for your benefits? Monthly checks don't come out of Congress's yearly budget. They're funded through the Social Security Trust Fund, which continues running even if lawmakers can't agree. That's why the payments themselves are not the first thing at risk. But the real challenge is in the services that surround those payments. During a shutdown, local Social Security offices may stay open, but with fewer staff on hand. That can lead to long waits in person, sometimes stretching hours. Phone lines, which are already difficult to get through on, can become nearly impossible to reach. And paperwork that isn't considered urgent, like replacing a lost Social Security card or requesting detailed earnings records, often gets pushed to the back of the line. In other words, the system that delivers the money still works, but the support structure around it slows down dramatically. For someone already dealing with disability claims, retirement paperwork, or urgent documentation, that slowdown can make life a lot harder. What about Medicaid and Medicare? Medicaid and Medicare are also tied to this budget fight, and for many seniors, they're just as important as Social Security. While Social Security provides income, Medicaid is what helps cover the cost of long-term care, nursing homes, and medical expenses for those with limited income. Democrats are pushing to reverse cuts that were recently passed, arguing that seniors and low-income families can't afford to lose access to these benefits. Republicans, on the other hand, are insisting that changes to Medicaid should not be tied to a short-term funding bill, calling it a separate debate for another time. And Medicare, while not facing an immediate shutdown of benefits, is part of the larger fight over healthcare funding. The way this budget battle plays out could influence how much money is available for Medicare services in the years to come. The result is uncertainty. And while benefits don't stop overnight, decisions made during this standoff could shape how much support seniors get in the future. What you should do, if you're applying for benefits or waiting on paperwork, there are smart steps you can take right now. Filing as early as possible protects your claim date, even if you don't have every document ready. Keeping records of your attempts to call or visit, things like call logs or letters, helps safeguard your rights under what's called protective filing. And if your local office is overwhelmed, remember that any Social Security office in the country can help you. These steps don't end the delays, but they protect your benefits if the shutdown drags on. Just pausing for a moment to share something that could really help you or someone you care about. If you're 65 or older, or helping someone who is, you probably know how overwhelming Medicare can feel. The mailers, the endless calls, all claiming they have the best plan, it's exhausting. When my team and I were looking into this, we came across Chapter, and what stood out wasn't just that they compare all 24,000 plus plans. It was their story. The founders built Chapter after their own parents got stuck in the wrong Medicare plans, and they realized just how many people were being misled or pressured into making choices that weren't right for them. That's what makes Chapter different. Their advisors aren't paid to push one plan over another. They're salaried, independent, and genuinely there to help you. You'll speak with a real person who takes the time to understand your doctors, prescriptions, and preferences and helps you make a decision you feel good about. And the call is totally free. No pressure, no gimmicks, just honest support. If you're already in the right plan, they'll tell you. And if not, they'll help you find one that better fits your needs. If you want to talk to someone today, give Chapter a call at 615-639-1937 or visit askchapter.org/money. Again, that's 615-639-1937. It's free, and it might save you a lot of stress. All right, now let's get back to it. And Medicare continues to be a political battleground, with disagreements over funding levels and program reforms. So today's fight is about a short-term budget. But tomorrow's fight is about whether Social Security, Medicare, and Medicaid, the three biggest safety nets for seniors, will be strong enough to last. So what do you think? Should Congress keep clashing over shutdown deadlines, or finally sit down to protect programs like Social Security, Medicare, and Medicaid before cuts become unavoidable?